You're listening to the podcast between doctors and friends. Welcome to another week of Between Doctors and Friends. We have here Dr. Foz, the doctor of everything, and we
Not
have
true.
Derek from the host of Daytime Tea with Auntie Derek. It's just going to be the three of us for now until people join in.
We love
Um,
Auntie.
yeah, we
And we'll
do
miss
love
Dr. Ray.
Auntie.
I love
And
you,
we miss
babe.
so we have a lot of loving this Sunday. Have another uh, glass of mimosa here. Um, and pardon my Dr. Foz, how was your week? Let's start with you.
I wish I had a mimosa. It was exhausting, but I would say par for the course.
Yeah,
Yeah, I have a little bit of a medical mystery I'm trying to solve, but other than got to look stuff up. But outside of that, it's all right. How
medical
about to our
mystery.
host? How was your week?
Busy, tiring week. So
Mm.
I'm a little bit I'm tired. So
And how about
uh,
Auntie? How was your
Auntie, how
week,
was your
Auntie?
week?
Oh, the week was pretty good. Not as busy as you two, but it was pretty good. And I was able to go to a cousin's 60th birthday party yesterday and had an amazing time. So happy birthday, Angie!
Happy
Happy,
birthday, Angie.
happy birthday to Angie, 60. Wow, what a blessing.
60's the new 30.
So how was it drinking in a 60-year-old party? Any drinking?
No, wait, no, we actually drank before we got there. There was no alcohol, unfortunately.
Wow. A lot of medical talk on a 60th birthday?
No, not that I heard.
Well, that's, you get to that age and it's always about, um, between doctors and friends podcast. So, I'm looking at the sign here and we are talking about preventive versus problem doctor visit. Um,
Yeah.
didn't know that there's a difference. Dr. Foz, why don't you jump in there and
Okay.
tell us about it?
So shout out to Dr. Ray. She
Yes.
can't make it today, but we'll see her soon. The so this is all a construct of insurance. I have to make that abundantly clear. It's an insurance construct. And that's why it's difficult to sort of wrap your head around. And I'm not an expert in these things. I just kind of know the basics because I'm also not a biller or coder and I'm not the insurer.
Okay.
But from what I understand from the ACA, which Obamacare, which was I want to say circa 2010ish or so. Don't quote me on that.
Okay.
The insurances are required to provide everybody who is insured with a free, 100% covered preventive care visit. The concept behind a preventive care visit is to prevent future problems. So, a blood pressure screening, checking for diabetes and cholesterol, which is really important. Checking for like iron problems in children, catching people up on vaccinations and organizing all of the screening tests that we know should be done on, either the general population at certain ages or, for certain genders or for people of certain risk factors to kind of prevent issues in the future. Because so that's separate than what we would call like problem-based visits, which are visits for follow-up on, chronic medical problems or new symptoms and concerns. Um, so it's really, I mean, truthfully, in primary care, we kind of do all of those things often, at least I do. I don't completely separate those out. I try to do things on a rolling basis. Like if I saw somebody for a preventive visit 6 months ago and now they're coming in complaining of knee pain, and I see they have not completed their colonoscopy, like, hey, by the way, did you ever like, do that colonoscopy? Oh, you don't want to do it. Okay, let's talk about that a little bit and what else we can do for colon cancer screening. So I try to do that, but it's difficult and a limited, we all have multiple appointments a day. And so that's where it's difficult. And But they are billed differently, and that's a construct of wherever you work or whoever you work for, or if you work for yourself. There's if somebody comes in for a preventive visit, but they're like, they have a high deductible plan with a higher copay, like,
Wait, give an
Mhm.
example of a preventive visit.
Well, it's what I said. It's like I'm here. Oh, wait, before I do that, I see a hand up.
Well, I just wanted to say I have a perfect example, one that I learned by accident. So
Uh-huh.
it was
Okay.
going to my chiropractor. And
Mhm.
how I discovered that was so long story short, I was working at a job and we were on strike. We were a union job and we were on strike at the time. The
Mhm.
chiropractor came by and gave us water. So I'm like, oh, that was nice of him. And I've been having like some stiffness in my neck and lower back. So then I went to I scheduled a visit and expecting to pay like a copay and noticed that I didn't have any. I'm like, oh, and they were like, yeah, you get like 50 some odd visits per year. But I learned that because of the type of job that I had, it was a sit down job and they had a computer all day. But I
Mhm.
guess there was preventive, that was preventive of future back pain or future. So I learned that the chiropractor visit was a preventive visit by mistake.
Oh, that's nice. Well, that might be built into the benefits of the company that you worked for. So there's also that, right? So not every insurance is going to provide you with free preventive chiropractic visits.
Oh.
And that's a little more unusual. I can't say I've ever seen that before. But I mean, I that's awesome. I think, get what you can. That's my attitude. But I would caution people to not assume that that's the case for their insurance, because once again, it may be built into um, the company that you work for, because perhaps they have a lot of, if you have somebody who's got a desk heavy job and then they're not really providing all the ergonomic equipment or training that they could possibly do. So then they may pivot to giving you, I don't know, some extra chiropractic care just to keep your neck and back in proper alignment and so that you don't have chronic issues. I'm just
Mm,
guessing, but I don't know. Um, but yeah,
okay.
preventives are to prevent problems as opposed to current complaints or issues. And so there's insurance forces a great divide between that in some cases.
So if a patient goes to a doctor about a problem,
Mhm.
that's a problem visit versus if the doctor was to initiate it and say, "Hey, you need."
Well, so initiation doesn't really make anything. It really depends on how the appointment was scheduled.
Oh,
So a
okay.
preventive visit's like, "Hey, I'm just here for my annual checkup, I
Okay.
just," so that's a preventive visit. And honestly, I know how that I should know these things, but I don't, because I'm not a biller or coder, nor have I ever, like, owned a corporation.
Uh-huh, uh-huh.
But, um, I will go over old stuff, like, if you have hypertension and your blood pressure is um, controlled on, 2 different agents, like, in part of my assessment and plan of that well visit, it's like, "Hey, continue current blood pressure medications," or something, and I will notice that, and I will order tests associated with that tied to the preventive care visits, so, you know
Okay.
but it's the nature of the visit is, I guess, what I'd say. It's meant to go over your current situation and review your family medical history, review your vaccination history, get you caught up on any vaccinations that you need, and also get you caught up on your like screening tests that need to be done, whether it's a pap smear, whether it's a PSA test, whether it's a colonoscopy, whether it's a mammogram, and in children, it's like, things like, their vaccines, of course, are really important. It goes over your social history. Like, are you a smoker? Okay, what are we going to do about smoking cessation? How much alcohol do you drink? What do you use any illicit drugs? What's your social situation? Do you suffer from depression or anxiety? It's about those things that we can try to identify. In senior citizens, sometimes there's a little bit of like a memory screen. Like, do we
Mm,
have any concerns about your memory? I mean, that's how it goes ideally. I will go in depth, like, what's your sleep like? And that's hard because when there's a problem, I can't necessarily fix it quickly. If like I'm concerned you have sleep apnea, I have to send you out for testing.
So
Um, mhm,
would it be similar? I'm just trying to like an analogy
mhm.
is, you get typically, right? My insurance I get two, um, you know, teeth cleaning every year, twice a year.
It's kind of like that.
Um, that's
Yeah, you get yeah,
preventive.
but if they find like a cavity, that's not part of it, right? And you
So
would be
that's a
billed for that.
problem.
Right. So
Okay.
it's kind of like that. And so that's why it's difficult because in this country, this is all a construct of insurance. And what happens is a lot of patients. So, okay, a little bit of this is just my take on things,
Okay.
just in the part of the world that I've practiced in. So, I'm gonna just kind of throw that. That this is just from my paradigm, but I've been doing this for a while. So prior to, uh, so it's really all about Medicare and the Centers for Medicare Services. They kind of set the standard for a lot of stuff. And
Oh,
so there was a movement starting, I don't know, maybe 2090, late 90s, where it was all about IC10, ICD. Well, at that time, I don't remember what it was, but it's ICD coding, right? And all that is standardizing medical language. So standardizing things. So if somebody has a heart attack, I can say that in many ways, right? So I can say, the layperson's term would be a heart attack. The medical term could be an acute myocardial infarction or acute coronary syndrome, or there's all these names, right, for like the exact same entity. And
okay.
so there was a push. I mean, I'm sure this is happening before that. It's just that these are what I can recall of knowing bits of it, towards like standardization of calling things something. So if somebody comes in, it's like you have a cold or you have an upper respiratory infection or you have a viral syndrome. Like there's all these ways to name something.
Okay.
And so using a code system gives you a standardized language in dealing with those. So, I-10 is essential hypertension or hypertensive disorder, or you know what I mean? And so it's like, oh my God, really? And so so there's the standardization of the language. And so that's why it forced doctors to document differently. And then also part of that is the movement from paper records where I could have written anything that I wanted, right?
Okay.
To in those days, like you
Check
could hand
boxes.
somebody what well, yeah, I mean, it's like in those days I could hand somebody a prescription. I could write it on a piece of like a prescription paper, hand it to them, and there you go. Like I can give you anything at any time. Now, because everything is on an electronic health record, I have to tie it to a particular diagnosis.
Oh, wow.
Yeah.
Okay.
So if in the past, if I gave you a prescription for, let's say, losartan for blood pressure, I could give it to you. I could also give it to you for heart failure, or I could give it to you for chronic kidney disease, right? And I could just hand it to you, and I could just write my note: losartan, 25 milligrams once a day, or whatever, right?
Mhm.
Well, now I can't give that piece. I can't give you a piece of paper. I have to transmit it electronically. And then I have to have it tied to a diagnosis, whether it's hypertension or congestive heart failure or chronic kidney disease or whatever it is. S So it's part of like the standardization of things. And the reason why that needs to be standard is so that your insurance company can figure out what you have and track it. It's about the aggregation of data, right? It's like being able to, who's got hypertension, how many people have it, how are we billing it, how are we going to pay for it, and all those things. So it's always about data collection. So it's to
Wow.
standardize the data collection. And so there are also things that are tied to that. And this is this is where my knowledge gets funny, is it's all tied to what we call CPT codes, right? So the CPT code codes the type of visit. So was it a long preventive visit? Was it a short problem pay visit? And if it was a long preventive visit, like what was the age group of the patient, right? So it's coded differently if you are under the age of 19, whereas if you're over the age of 60, 65, um, and and those are all just to comply with insurance and CMS demands.
Wow. Do you guys think have to take a course for this, or like
No,
to be
see, well, I don't
oh,
know about now because I'm old
uh,
enough to not have been like, but these are things that nobody sat me down and taught me. These are things that I've gleaned from what I've been yelled at for doing wrong. For like,
wow.
it's not like they
Uh-huh.
teach you how to do this. You're expected to do it correctly without anybody saying anything to you about it. And so that's when I just want to lose my business. And it depends on where you work. I mean,
Yeah.
there's such a great, variance in this. And it's just also like, hanging out with billers or coders or having to do my own billing and coding. And so that's also what happens now is before, like when you saw a visit, like it would all be sent to billing and billing handles everything and that's it. And so now like I have to do my own billing because it's built into the EHR. So I just click, click, click or whatever, it is. And so it's a lot of it has to do with what is billed to the insurer, right? So if it's coded as a preventive visit, then it's free, it's covered. So even if I did, I'm just joking about this, but I'm just going to throw this as an extreme example. Like even if I did like open heart surgery on you in that visit, but I billed it as a preventive visit, it's a preventive visit, right? But that's where you kind of have to be careful because two things come up with that is unfortunately not everything is going to be preventive. Like if you come to me and you're like, I'm just here for a checkup, and you end up having this fungating breast mass that's ulcerating and smells bad, and I'm like, oh my god, that's like very advanced breast cancer. I'm just using that as an
Mhm.
extreme example, right? um okay, now it's like, well, now that's a separate problem and I can't, that's not preventive, like I have to do something about this. So you're going to probably get they'll so that visit will be coded as a preventive visit, but there'll also be a problem-based visit tied to that. So, and a lot of it depends on your insurance. Like this is very different if you have like an HMO plan.
Yeah.
So HMO plans are different because it doesn't really matter what you do during the visits because the patient only has no copay or has limited things. Or if you were on like Medicaid and state assisted insurance, um, so it gets quite complicated, but it's all about ICD-10, which is now ICD-11, and I still ICD-10. I don't care. I just don't care. Or the CPT code associated with the visit. And so that really kind of determines the level that, and so there's pressure on us as physicians in a private care. So in the private practice, like uh situation, there is a huge amount of pressure for you to code as many things as you can during a visit because that equivocates to a higher level of billing and therefore higher reimbursement. So if I have a 15-minute visit and yeah, I know, and somebody comes in with Auntie's little emojicons. So if somebody comes in and they have like, I don't know, they have a rash
Yeah.
and it's like dermatitis or something,
Uh-huh.
but you're like, "Hey, how's that COPD coming? Are you using your inhalers okay? And let me see here. There wasn't anybody in your family that had any lung disease, right? Okay. And you're taking all your meds. Okay. Oh yeah, and your blood pressure's looking better. How's the medication going? Okay, you're walking around fine. Okay, cool. You're watching your salt. Okay, awesome. And how, speaking of walking around, how's your knee arthritis? Oh, okay, that's been worse. Okay, well maybe we should get an x-ray for that. And let's come together and see how that looks after some physical therapy. And oh, I see that you're due for your flu shot. Let me update that for you. I've now turned a because I've touched
Preventive
on
visit.
and this is a
Uh-huh.
very broad thing, but I've touched on family history, right? I have touched on preventative care and vaccination updating. I have talked about your knee arthritis. I've talked about your COPD, and there's certain things that have higher yield or things because this is data that like CMS really wants and everything. It's like COPD and diabetes and hypertension and chronic pain issues and mental health things. Like these are kind of like, so if you touch on certain elements and we say we talked about, okay, you got your rash. Okay, what have you tried for it? Okay, what does it look like? How long has it been bothering you? What makes it better? What makes it worse? Okay, your knee. Okay, we know how long have you been having knee problems? Okay, when did it start? How did it start? Was there trauma? What makes it better? What makes it worse? If I touch on a couple of elements of those things. I mean, I feel like I need to do that because I need to document an appropriate medical history.
Okay.
Knee pain that's been gradual onset in a 60-year-old, that's worse with more activity and better with rest is a lot different than sudden painful red knee swelling in a 20-year-old who has multiple sexual partners and is running a fever. Like that is a very different diagnosis. So the history, that's sudden onset, right? So that history makes a big difference in the diagnosis. So I do want that information. I don't want people to think that when I'm asking these questions that I'm just trying to bill the insurance. I'm actually trying to determine if what I think your diagnosis is actually correct. So part of it is historical. And that's why, like last time we were joking about people who can't tell a story to save their lives.
Yeah.
That helps me come to a diagnosis. So be able to tell a somewhat sort of maybe coherent story, right? But
Wow.
yeah, but I mean, it's also when you have certain elements, we've talked about your pain. If I hit on 2 or 3 elements of the pain has been addressed. And so now that I've done blah, 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 now instead of like a 99213 visit, that became a 99214 visit. And that will now become, um, that will result in higher reimbursement. So that's part of
Wow.
what, yeah. And so so at least I don't know what it's like in specialty care because I don't do specialty care, right? But that's what the deal is. It's about billing more so that you have more reimbursements so that I get paid or the company that I work for, not me, gets paid more for the time that I spent on that patient's care. But remember that now my 15 or 20-minute visit that was supposed to be for a rash has now exploded into 6 different things, of which I have to assess the patient, listen to their
Yeah.
story, document what they have to say, document my physical exam, document my assessment and plan, and actually place the orders for what I need to do for this patient. Also make sure that they fully, and this is where my biggest thing is like, do you understand the plan, honey? Okay, so I'm not telling you that you have arthritis in
Don't
your
call
knee
me
because
honey.
I'm gonna say it. Fuck it. I'm old enough to say it now. And if you don't like it, go find another doctor. And,
You know how
well,
people
I
get
mean,
defensive.
I'm
You
not
know.
really gonna do that. I mean, I'm not
Yeah.
gonna, but it's just like, let's look at your knee. Um, and I love it when people call me honey and dearie and sweetie because it's endearing and it's nice and it's
Uh,
like, it's kind and it's showing that it's not, it's just, I don't find it patronizing at all. Okay, that's just me. So now I have all this work that I've created. But most importantly, I have to be able to communicate with my patient to understand, like, hey, I didn't tell you that I thought your knee was fractured. I didn't say that. I'm going to get an x-ray to make sure it's not, or whatever the situation is. And so
mhm.
I'm trying to, um, make like I think it's really important. This is what I think really helps people get ahead in their medical care, and
Mhm.
it also brings us together closer, you know? But it's just like, I want you to understand what I think is going on and what the plan is so that we can work together towards a solution. And sometimes that solution is just making you less anxious about what you have. Like, I don't think your abdominal pain is a sign of something terrible. And this is why, and this is what we're going to do about it to prove it. So work with me on this. And so when they always say, the doctors don't listen to you, blah, blah, blah," it's because they're doing 15 different things
Wow,
while they're also talking to you.
you guys are really
That is not,
thinking.
yeah. I mean, and I know that Dr. Ray was like kind of implying last time. She's like, well, there's like, 20 things that she does. And she's, yes, like if she has postmenopausal patient who's been bleeding, she has to do X, Y, and Z. Like she has to do that because that's the proper thing. But that doesn't mean she's not listening to what she's saying or not assessing and thinking, oh, we have to do X, Y, and Z, but that actually might be this. And so I'm going to do this instead. And also just telling the patient, hey, like this is what you need to worry about, this is when I'd want you to come back. Like it's that communications thing. And that's where people get upset when they say, my doctor doesn't listen to me. It's like, well, we are trying to listen to you while we're doing everything else. And I do think that there are people who don't listen, but I think that a lot of patients don't listen to what I'm saying either. So it's not,
100%.
it's not a doctor
I'm not.
thing. It's not
Uh-huh.
like doctors go to school. Okay, this is how you don't listen to people. Oh my God, we don't want that at all. But just like everybody else, it's like it gets beat out of you sometimes. I know, right?
Wow. Wow.
This podcast should be retitled to Dr. Foz's gripes.
Preventive versus problem.
But I mean, we want to fix these things. I want to listen to you.
So
I will reflect it back to you. So what you're saying is this, but I have to do that all in
so
15 minutes
question,
while I'm
is it
also doing stuff on the computer, of which I'm like not, I was not born with a cell phone in my hand. Okay.
so I have a question. So is it harder for you? Is it more difficult for doctors like on a Monday morning
It can
versus
be,
like at the
yeah,
end of the day because
because
your
things have
brain
built
has
up over the yeah,
uh,
classically, the worst days are Friday afternoons and Mondays, because invariably on Fridays, it's like, well, it's 3 o'clock on Friday, and you just had head trauma, of which I think you really should have a CT, and if it was, like, Thursday morning, I could order one stat and probably have one, in a few hours, and then I'll know, assuming that your insurance company will play ball.
uh,
So now I can't. Now I gotta send you to the ER. And then Monday,
wow.
sometimes it's things, but I can't really say that I've
For all
seen that.
doctors,
Like,
generally,
yeah, I mean,
or
that's
for
like
you.
yeah, I can't really. Okay, now I've cursed myself. Now every
Yeah,
Monday I have from now on is going to be like the worst Monday I've ever had in my life.
it's like, oh, oh my gosh, that's
But so to circle back to the original thing, so a lot of patients though don't they don't want to, because they have, okay, I'm going to back this up a little bit. Um I have seen there is a movement, or there has been a movement, so from away from HMO type plans. So those are plans that are lower cost. You have an assigned primary doctor, right? So that you can change who you're assigned to, but you have to have an assigned primary doctor.
mhm,
And you have a limited network. Like if you need to see a gastroenterologist, let's say, it has to be from one of these 6 different practices, because those are the 6 practices that are in the network. And if you want to go outside of that network, you can't do that because it's not part of your network. It's like kind of like pre-negotiated everything, right?
such
Um, there's caps on things, like your office visit pays are only going to be X amount. There'll be no surprise bills. That's it. There was a lot, that was what a lot of companies were providing as insurance. Then there had been, I don't know, maybe 10, I don't honestly know, I can't track these really well because I don't know. There was a larger movement towards now, moving away from those, but to high deductible PPOs, right? So a PPO is a preferred provider organization insurance. It's generally also called like open access insurance, and you are not tied to a small local network. You are tied to a larger insurance based network. So let's just use, like, I don't know, United Healthcare. I'm gonna leave a very pregnant pause in
okay.
how I feel about that. Um,
Well,
so let's say you
okay.
have United Healthcare PPO. There's gonna be like different levels of coverage within that, right? You could have their platinum tier or their silver, whatever, right? And a lot of it's going to be negotiated by the company that you work for who's providing you this insurance. They may have extra perks or extra things. And in that, you are limited to a network, but it's pretty much anybody who takes United Healthcare PPO, which is like kind of everybody, if this makes any sense. So you
Mhm.
can do whatever you want. You don't have to have a primary physician, and you can go wherever you want, do whatever you want, as long as they take United Healthcare PPO. Um, that becomes difficult. You may still require referrals to certain specialties for, and it's just reasons for, like, people say, "Oh, I'm having headaches. I need to see a neurologist." But instead of seeing a neurologist, they'll try to make an appointment with a neurosurgeon. That's not the person to see. That's really the neurologist. So to kind of prevent inappropriate self-referrals, sometimes some specialties will have, you have to have a referral to see them, if that makes any
Wow.
sense.
Yeah,
But
yeah.
you don't have to have a primary care doctor. You can, it's kind of whatever you want to do. And but those are higher cost. They are higher deductible. So like out of, you may have, a $70 copay, or I don't know, $110 copay or something each time you see the doctor, and that none of your stuff is covered except for your guaranteed free preventive visit until you've met your out of pocket deductible for that year. And if that's like $5,000, like everything you do, you have to pay for.
Yeah.
So that's where some issues come from, because now a lot more people, and once again, this is just kind of what I've been told and kind of what I've seen, have open access PPO insurance, but now you have higher out of pocket costs. So now you're trying to do everything at your preventive visit, but I can't because it's not a preventive visit if we're talking about tons of new problems. So that's a billing and coding problem,
Jeez,
right?
I think we need to bring in, a coder as a guest. What do you think? Billing coding.
Yeah.
Look,
Let's
I'll
Well,
see if I can
okay,
find
hold
one.
up. Hold up. Yes and no,
Why? Go on.
because not all coders are created equally.
That's true.
And not all, like, one of the corporations that I worked with had their chief of billing was the most crooked, lying, unethical, horrible human being that I've met in a really long time. But this person was the VP of something, and I
Yeah.
just that's not the person that I would talk to.
Me too.
That's like
Right? We have to vet them.
yeah, well, you know what? Yeah, we would need to.
Yeah.
I see a hand raised.
Oh, I was
No.
saying that I know a coder. I was like a billing coder, and now he's a. Actually, it's funny. Now he is a director for coding or billing coding, but he's not the director that you're talking about.
No, I'm yes, I will make it clear. The person I'm talking
I know
about,
a
I
coder.
yeah,
She goes by the name of Sandra.
not that kind of
No, no,
coder.
no, no. I know. I
I'm kidding.
actually, I do. I
Oh,
know a
look!
billing
Look who
coder.
showed up.
Oh, hey, that's what's up.
She
The
said
But
you
yeah, I
coders,
rang.
yeah. The
okay.
d
I
the lead
I go
coder
to
that I
him
work
all
with
the
is
time
awesome.
though. Oh, is he?
Yeah.
Okay, that's what's up.
Yeah.
Yeah, I go to my friend all the time, especially when I'm dealing with like little petty shit. And I just
Uh-huh.
be like, oh, wait, can we curse? Can we curse on this? I'm sorry. I
Yes,
don't
we
know if we
can.
can.
We
Okay,
can.
great. Yeah. So
Fuck
when I'm
yeah.
dealing with little petty shit, right? Like
Dr.
you
Foss
got
cursed
you
all the
got
time.
you got a doctor that's charging, out the fucking woodworks. And then your insurance is like, oh, well, we'll cover 97.5% of this. Bitch, if you don't cover 100% of that bill and stop playing with me, why the hell would you bill me for $10.72? I'm not fucking paying it. So I'll call my friend and be like, hey, friend, you and billing. How long should I wait to not pay this before the billing team actually just like wipes it off? And
Oh,
he'll give me
yeah.
the tea. He'll be like, "Oh yeah, like if you don't pay it in like 9, 10 months, we'll probably just say fuck it and just wipe it off." So I was like, "Okay, great. I'll hold off on paying because
What?
medical bills they don't, especially when you look at like you got to look at your bill and make sure you read it to see that there's no penalty or that they won't necessarily send
Some
it for
they will send it
collection,
to
right?
collections, some will.
Yeah, yeah.
Like,
And so
yeah,
that's
they
what I
will.
asked. I'll check with him. I'll be like, well, what's the threshold for collections? And he'll be like, usually if it's like, the last time he told me was like, if it's like over $100, we'll send it for collections. But if it's under, we usually have like a fund that we can use to write off shit because it's not worth sending it to collections. And I was like, well, my bill is $10.72. You think they're going to send it to collections? He was like, bitch, they don't give a fuck about that bill. I said, okay, well, I'm not going to pay it then. He was like, but
Oh,
he said, you gotta wait to see because if you schedule an appointment with them, they're probably
Yeah,
gonna tell you to pay that bill before you can get to that next appointment. And I said, well, thank
100%.
goodness it's an annual meetup. So unless if they wipe it off within 12 months, I'm good to go.
Yeah, there's all kinds of, like, I mean, there's it depends
Girl,
on
fuck them in that $10. That's crazy. Like, you got
I think it's
everything
ridiculous.
else.
Yeah, but at the same time, I mean, it's we d like, I have never worked anywhere where I have any control on any of those things. Like, I have no idea what's happening. Like, I have patients who come in, like, really bad,
Right.
like,
So
"This was
you
sent to
as a
collections," and
doctor
I'm like,
don't
"I don't know
control the
what you're talking
rates.
about." I'm like,
uh-huh.
But
why?"
do y'all control your own rates or no?
No, well, you know what? It depends on who, like, I don't work for myself, so I
Oh,
don't control none of that. I'm corporate. So
So if you
okay.
own
I
your own
work
Okay.
for
practice.
an entity, and
Mhm.
I have worked for myself, I have worked for entities, but I've never had my own practice per se. And so that's why I don't yes, you well, when you negotiate with insurance companies, I do know okay, what happens is these rates are up for renegotiation periodically, and a lot of the practices I've worked for in the past, like I would have the network that I worked in had this really great group that I really like to work with as a specialty group. And every once in a while, they will fall out of network. And so all of my patients that were seeing them can't see them, and I'm like, I can't do new referrals, and I'm like in a panic because like it's like, hey, I have so much trust in you. I don't know anybody else around here. Like, what am I going to do? And they're like, wait, just hang on, like give it a month or so because we're just doing this as a negotiation tactic because UHC or whatever other evil entity is not playing ball, so we're going to fall out of network and see what they
And
do. Right?
UHC is just the United Health,
I'm
right?
just using that as an
Yeah, yeah.
example,
Just an example.
Oh yeah, child.
as
We
an
know about the
evil
UHC.
example.
They are an evil, but I will say this. When I had UHC insurance through my job, of course, not paying on my own, because paying on your own is crazy. That insurance was damn good. UHC was covering, or at least the plan that my company had with UHC, because like you said, you got to go into negotiation ball with them and see what the fuck they do. The plan that my company had, baby, UHC was covering shit at 90%. I was like, oh my God, honey, you could just
Wow.
child, if you need a surgery, I'd be like, go, girl, go get that surge, honey, because you'll never see these rates again. You know what I'm saying?
Yeah. Well, once again, I'm using UHC as a just a blank
Yeah.
insert
Blank entity
Dr. Ray's
of
ears are burning. Dr. Ray's ears
yeah.
are burning. She owns her own practice.
Right. So she's actually the person to ask about those particular questions. And so I
Mm-hmm.
don't, but yes, there are rates that are set, but there are often things like you're part of a network, like an independent practice association, all those things, and those come together to negotiate larger deals, right? It's like, hey, we have
Mm-hmm.
1,000 independent providers in this network, so we're going to give you this many patients, so play ball with us, right? So it's always
Right.
about business negotiations and reimbursements and all those
Yeah.
things. But all of those things tied to CPT codes and ICD-10 codes really drive what happens. That's really what I think happens. And that's
Okay.
why we have all of these discrepancies. So you have these patients who are now like, they have a high deductible PPO, and so everything is like, how much does this cost? And it's really kind of scary because a lot of times I'll have a patient who'll come in for a routine visit and they're like, everything okay? Yep, I'm fine. Or, and then you wonder if they're just afraid to say anything, which is also part of it. It's like, I know, I get it. Like, I'm also a patient, people. Like, I'm not
You
just a provider.
are?
I'm also, give me a break. And then, what
Actually, that's
happens?
so
Like, I'll
funny
be,
because
mhm.
we really don't think of doctors as patients.
Oh, of course
Like
not. You guys
I
think of
don't think I've
me.
ever thought of a doctor as being somebody else's patient.
Well, you guys think of me as somebody that's just standing there to tell you no on things all the time, and, like, that's not
It's like when
I get it from the patients when they complain about their insurance, and they're like, "What do I do?" And I'm like, "I don't freaking know. I don't know." And then I get my own bills, and I'm like, "What the hell?" Like, I don't like I don't
it's like when I see a pilot sitting in the passenger seat.
Yeah,
I'm like, "Oh,
and then
okay."
yeah, it's a weird place to
Wow,
be
it's so
because I get
interesting
it on both sides.
that you go through that as a
Of
doctor,
course. I don't really
right?
fully understand my own insurance. I'm like, "I don't what is this? Is this covered? How much do I have to what?" And then I ask the provider, and they're like,
Wow.
we don't know either because you have to talk to our billers and coders."
Yeah.
So it's the blind leading the blind. But, so what happened is, like, in the preventive visits, you will have somebody who'll come in and you actually find a problem. Like, commonly, I'll find, like, a thyroid nodule or something. And I'm like, "Oh, well, we need to get a thyroid test, and I need to order a thyroid ultrasound to see what the structure is. Maybe it's just a cyst, maybe it's a tiny multinodular goiter or whatever." And then the patients will they're like, "Okay." And then the patients will, go to get the ultrasound, and they'll be, "I don't wanna pay for that. That's for $500. I don't wanna pay for it, so I'm not gonna do it." And I'm like, "Well, I hope you don't have thyroid cancer." You know? They probably don't,
Uh-huh.
but I did I have had 2 instances in the last decade where I've had healthy people come in and I happen to feel their thyroid and I happen to feel like a bump, and I'm like, "Let's work this up," and both of them end up having thyroid cancer. Now don't panic. I can tell right now everybody is putting their fingers on their neck and they're like, "What's this? See? Stop it. Just stop it."
It's fat.
Um
It's what I ate last night. Not just kidding.
Period, happy. Period. Okay,
Yeah,
that's
so
what
but
we
now
feeling when we
the
eat.
patient will say, like, "I don't wanna pay for this." So now I'm like, "So do I have to do it?" I'm like, "Okay." My answer is invariably, if I didn't think you had to do it, I would have never ordered it for you. Like, yes, you should do it, but if you don't wanna pay for it, there's nothing I can do about it. I hope you enjoy your thyroid cancer. Like, I mean, Statistically, it's not that. But I have to prove that it's not. What do you want me to do about it?
Yeah.
So then people
Yeah,
come to me
you
like
guys
all
are
mad, and I'm like, this is not my problem. This is a you problem.
you're
So
in the
everybody
line of
wants me to
target.
solve all of their problems for everything. And that's when I want to start quitting. Like I don't need this. Like I am not the problem solver for you. I am trying to help you, but if you think what I'm doing is, you don't want to pay for it. And a lot of times I get it. Like I am also not made of money. If I were, would I be working? Not like I do. And and the thing is like I understand, but I can't control it. So that next time get an HMO policy with your company then it's cheaper. Like,
Mhm.
and a lot of times the people who don't wanna pay, I know this is gonna sound terrible, I'm so mean, but a
That's
lot of
what,
times people,
doctors between friends, okay.
exactly, but a lot of
Say
times
it.
people who, like, are telling me this are not people who are down on their, these are wealthy people or people who would be like, "Okay, you are well into the middle class, and
Mhm.
you have the most expensive $2,000 phone on you, and you drive a very nice car, and you live in a very nice part of town, but you don't wanna pay a few $100 for this ultrasound that is medically necessary, so I don't know how to help that." Like, and you get an FSA or HSA or whatever from your job, and you don't wanna use that because you wanna use that money to invest to increase your portfolio. Well, that's not my problem. I
So
see that a lot.
you really just need to just let go, huh? I mean, mentally for you as a doctor, you just like
It's hard because when I see something get worse
uh-huh.
because of dumb decisions, like, I am really scared for them. All
Uh-huh.
of our eggs are in the same basket. If something happens to the patient, am I liable? Right? But I did everything I can. I don't
Uh-huh.
care about that though, because I have to do what's right. I have to do what's right. So I kind of have this hopefully blind, foolish faith that if I do what's right, everything is going to be, as at least I have no guilt in any of this, right? But when you
Mhm.
have patients who are not hearing you and you're just like, "Why is this such a problem?" I mean, I've had patients with very serious stuff who are like, "I'm not doing that." And you're like, "But you had an abnormal stress test. I'm afraid you have heart disease." Now, I don't, maybe you should do with the
Yeah.
cardiologist. I don't wanna do that. I don't know. I just don't want to. And you're like, "Okay, let's sit down and talk about what it is and why. Let me see if I mean, you can explain something many ways, many different styles. Let's dumb it down. Let's repeat it. Do you understand my concerns?" And you still have people who are just like, "No." And it's like, or I just don't, I don't know. I'm very much of an attitude of like, "Hey, it's a free country. Do whatever you want. It's like you're making an educated decision." But if your doctor's coming at you in a state of somewhat hysteria, maybe you should take that under consideration, you
Wow.
know?
Wow. Well, we're gonna end this short. This is really good. Any last minute questions for this episode? Otherwise we could use it for next week's episode.
No, I just wanted to thank Dr. Foz because a lot of the stuff that she said on today's show, whether she realizes it or not, was very insightful. So thank you. I'm always
I I
happy
hope
to
it
hear your
helps you.
insight.
Thank you. I hope it helps you understand kind of what happens when you guys go see your doctors or have to deal with your billers and coders and all those things and why. And that it isn't often your doctor, it's their s- it's the corporation that they work for or the situation, or in patients or in people like Dr. Ray, right? She's in private practice, owns her own practice. You know, girlfriend went to a lot of school and does not ever sleep because she's delivering babies at all hours of the day. You know what I think? I think she deserves to be paid for that.
Mhm.
I think she deserves to be able to put her children through college for that. I think she should be able to fund her retirement so she's not worried about being able to feed herself when she's retired. I think she deserves that. So, yeah, she should, those bills should go to collection when it happens. I mean, it's like it's not a question of greed, it's a question of what's fair.
That's true. Well, boy, preventive versus problem. I'm gonna have to think about that next time I text you.
So I could bill you appropriately.
Is this a preventive text or a problem text? All
Girl,
right.
that is so
Uh,
funny. So I can bill you appropriately.
we pay each other by Del
This
Taco.
is such a great episode. I know I came in late, but I have thoroughly enjoyed it. Like this
I
is
ho-
this good tea.
I hope it breaks it down kind of like some of the mysterious bullshit that's there. And I don't even know on the real, I don't even know if I'm 100% right because some of this stuff I'm like "Wh- what?" Because I also don't I don't handle
Yeah.
those negotiations. I'm not part of it. I'm just a little tiny cog in this big ass wheel.
Wow. All right. Well, that's it. Thanks, Dr. Foz. Thanks, everyone.
Thanks
Hope you
everyone.
join us
See you
next
next
week.
week.
Bye bye.
Bye.